What's happened in America is that a baby was identified at the point of childbirth, and the mother was found to be HIV positive during labour. So normally what would happen is that an HIV positive mother would be diagnosed early and treatment would be started before labour actually happened. But this didn't happen in this case. So instead, the child was born and then therapy was given to the child almost immediately. And rather than just being given a single drug, the child was given a three-drug cocktail of drugs, which is what you would normally use to treat a patient who is HIV positive for their standard treatment. Now, what is thought to have happened then is this very potent drug regime has hit the virus so hard, so early on, that it has failed to take hold in the child. And effectively, the researchers are telling us that they think they may have cured this child by doing that. But there's still a number of questions that do need to be answered. I think that doctors are cautious, so I think you have to put it into context. So what we know, curing HIV has always been that sort of impossible dream. 2-3 years ago, we'd have been told it is impossible to do this, it can't be achieved. But slowly, there have been a few little cases. There was a case of the Berlin patient, an adult male who's been cured of HIV, and now there's this case of the child. And it just starts to make the research community and the clinicians and hopefully the patients think that in the future, a cure for HIV is something that might be a realistic goal. So the implications here are very narrow in some ways. It tells us that we need to research into cure with sort of stronger funding and a greater drive. At a clinical level, it doesn't mean anything for patients in terms of coming off drugs or anything like that at the moment. The message is not that people can stop taking their drugs and see if their virus comes back or not. That would be an absolute disaster. I mean, people need to carry on taking the drugs and get advice from their clinicians. But I think before we can do any of that, we need to be absolutely sure, first of all, that this child was infected, and then we need to be absolutely sure that a cure has been achieved. And the researchers are going to present, I think, some reasonable evidence to suggest that this child really was infected and it wasn't just a contamination of assays or anything like that. It is a surprise. I think we've always known that if you treat HIV very early in the course of infection, if you can get right in there from the point of transmission and get drugs into the patient early, that has a major effect and could possibly do something remarkable. But this is a fantastic example, if it is true, of what might be more sort of broadly achievable.